I'm Orville Fisher. I'm a stroke nurse navigator. The job of a stroke nurse navigator is the chief cook and bottle washer of stroke care. Patients come in unable to speak, they're scared. I'm here to make it less scary.
I'm pretty proud of him. He's done lots of good work. Some days I have to remind him of that.
But when it's you becoming the patient, it's just totally different. I started with Saints in 2011 working in the emergency department. In 2014, I was introduced to Dayla Hall, who had just taken over the stroke program and was tasked with helping bring us up to date.
The vision would be to get patients treated as quickly as possible.
The stroke program was somewhat struggling when we took over. Our door-to-treatment times were not what we wanted. We were averaging about 90 minutes. I remember going to the ER doctors and telling them that we needed to be under 60 minutes.
I'm Dr. Jaron Marriott. I tell people I specialize in brain emergencies. So the most critical thing about stroke care, the faster that we can help you, the faster we can treat you and potentially prevent disabilities, death. It's always about time.
A code stroke is called, which activates the stroke team.
Immediately you have nurses, you have CT techs.
We take the patient right to our CT scanner because we want to see what's going on in the brain.
While all this is happening, those ER nurses are starting IVs, getting the blood sent off to the lab.
And within minutes, we know what's going on, we know how to treat him, and we can get that treatment to him.
I remember very distinctly the day we got our first patient under 60 minutes, and we had a little celebration. Now, 50% or more of the time, we actually provide that medication within 30 minutes of the arrival. Our absolute record, 4 minutes. In September of 2021, I decided to do the ultimate product test on our program, and I became my own patient. We were going to get up early that morning to build fence. My wife had worked the day before. I told her, just stay in bed and sleep an extra couple of minutes and I'll fix us an omelet. As I was chopping stuff up to put in the omelet, I suddenly realized I'd lost all the vision to my right side. My first thought was, that's weird. Second thought was, oh, I'm having a posterior circulation stroke. Then went in, woke Courtney up.
And what's going on? And he's like, well, I think I'm having a stroke. And it's like, okay, wait, what? And started to get up and get out the door because time is of the essence. So it was a little nerve-wracking.
He called us and we initially thought it was a joke. We thought he's joking with us, but it was real.
The whole team was there waiting for me at the front door.
It was very frightening that day. A few hours of what are we dealing with, and then just, okay, now what?
That day, looking at that crew, knowing how they've been trained, knowing that they're willing to do whatever's necessary to get me the best care that they could possibly give as quickly as possible was both humbling and gratifying.
Before he even hit an ER bed, we had treated him for his stroke. Wonderfully, it helped. Orville got better rather quickly.
Didn't have any weakness. I got my vision back.
He's one of the only times I've ever seen somebody initiate their own code stroke.
They did their job, and they did it well. I was so grateful and so thankful. He's living, walking proof that they do a good job.
Orville is a special person for us. He is the first stroke navigator for SSM St. Anthony. He put his heart and soul on the stroke care, always.
Orville has always had a passion for taking care of these stroke patients, and since his stroke, that's even given him more insight into what it's like to be a stroke patient. So when he goes out and he talks to communities, he's able to tell his story.
That's why when we do community education, we're always telling people, get to the hospital as quickly as possible. Don't lay down, don't take a nap, don't see if it gets better.
Every minute count. 1.9 million neurons per minute died when the brain suffered a stroke.
So I want people to recognize what a stroke is, how it presents, and then get to the hospital so that we can take care of you. This program is kind of a legacy of Orville. I'm really proud of all that he's done here. I'm proud of St. Anthony for the program that they've helped develop.
I am very thankful for our team that we have. To watch them come together to take care of these patients is amazing.
He and Dayla and the team have done great things.
None of this happens unless everybody's working together. And that's one of the great things about Saints is everybody works together.